Stat 9. In 2023, a medical guide called StatPearls reported that preventable medical errors cost the US more than $20 billion every year. These are mistakes like giving the wrong medication, missing something important on a test, or not catching a serious illness in time. These errors don't just cost money, they cost lives. StatPearls says these kinds of mistakes are one of the top causes of death in the country. That alone is serious. But it gets worse when we look at who's being harmed the most. Another article, also from StatPearls, looked at how people from different backgrounds are treated in healthcare. It found that discrimination still happens in doctors' offices and hospitals, not always on purpose, but the effects are real. People of color, especially Black and Hispanic patients, often get worse care. They're more likely to be ignored, misdiagnosed, or sent home too early. That means these preventable errors, the ones we just talked about, hit them the hardest. A third study from a journal focused on healthcare fairness pulled all of this together. It found that safety problems happen more often to people from minority groups, and not because of the patients, but because of how the system treats them. So let's be clear. This isn't just about accidents. It's about a system that doesn't treat everyone equally. When people are already struggling to be heard, to be believed, and to be helped, medical errors don't just happen, they multiply. That's why we talk about DEI, which stands for diversity, equity, and inclusion. It's not about politics. It's not about quotas. It's about saving lives by making sure everyone gets good care. When hospitals hire more diverse teams, when doctors are trained to understand different cultures, when we actually listen to patients who've been ignored for too long, errors go down, outcomes go up. So if we want to reduce these deadly mistakes, if we want to save billions of dollars and thousands of lives every year, we need to treat fairness like it's urgent, because it is. That's what DEI is about. And that's why I'll keep saying equity saves lives.